as much as we want to say that we're in the wellness and health business, we're as a acute academic medical center, we're in the sickness business, right? I just told you we were the largest transplant organization last year in 2024. That means our patients have already had chronic diseases to the point where they needed to get a new organ. And so we need to figure out, how do we create the environment where we have the entire spectrum and we actually have focused strategies for each one of those different patient segment populations? I know it's a generalization, but we have to be able to figure out how our strategies align with those different populations and what are we actually doing about it.
New choices, new players, new models of care. You know, consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. What if healthcare was actually centered around what consumers need and expect? We're talking with leaders who are making it happen one experience at a time. I'm Jared Johnson, and this is episode 414. Today, we have the Flava of the week about generational attitudes towards digital health. What did Rock Health's latest survey tell us about how each generation feels about virtual health and other offerings? And how can we factor in age while designing consumer-centered experiences? I'll talk about that. Then we welcome Dr. Peter Chang, Chief Transformation Officer at Tampa General Hospital, to share insights from his work leading digital transformation, including how health is not delivered by a health system, how to think of the individual components of a strategic plan as an operating system, and the unintended effects of not truly personalizing digital engagements. It's time for the awesomeness, y'all. Are you ready? Let's go.
Flava of the week.
How people engage with health tech depends a lot on their age cohort. That's according to Rock Health's recent report on demographic trends in digital health titled Screenagers to Silver Surfers, How Each Generation Clicks with Care. The results came from their 2024 Consumer Adoption of Digital Health survey with more than 8,000 U.S. adults responding. While generational differences will surprise exactly 0 people, it's worth diving into a few of their findings to confirm or invalidate long-held beliefs about the intersection of age and digital health behaviors. See if you can guess which age group I'm pointing to with each of these descriptions. This generation sports the highest users of digital-first healthcare, with 68% embracing virtual care and 66% adopting wearables. This, of course, refers to millennials, ages 25 to 44. Members of this generation are anchored by strong provider relationships. As care coordinators, 90% of them are comfortable sharing their health data with their clinicians, and 35% track at least one health metric digitally. Would you be surprised to know that this is the silent generation, ages 75 and up? Next, this generation is testing new frontiers of digital health like true wellness explorers, with 60% using virtual care in the past year and 29% turning to AI-driven tools like ChatGPT. That's right, say hello to Gen Z, ages 18 to 24. The next generation takes charge as medical managers, with 39% relying on tracking health metrics digitally and 52% utilizing at-home prescription delivery services. You guessed it, this is boomers, ages 65 to 74. And finally is the generation of virtual pragmatists who incorporate virtual more selectively and lean on trusted provider relationships. 54% of this generation used virtual care in the past year, and 71% feel open to sharing their health data with providers. Don't forget about Gen X, y'all, ages 45 to 64. These are fun findings that I think could play out well at a cocktail party, but let's remember the report's conclusion that says consumer engagement with digital health isn't one size fits all, and age is just one part of the story. For companies looking to drive adoption in digital health, meeting consumers where they are means designing with generational and individual preferences in mind. And that's the real story here, y'all, regardless of which generation each of us falls into. Let's factor in age while at the same time remembering that it's just one piece of a very large, very complex formula for making healthcare more consumer-centered. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. Shed is revolutionizing health and wellness by making wellness available to everyone. Through personalized nutrition, high-quality supplements, and science-backed wellness strategies, Shed empowers individuals to take control of their health and live longer, healthier lives. Not sure where to start? Try NAD+, the ultimate coenzyme that supports cells, DNA repair, and anti-aging. Or maybe you'll like LDN for managing chronic pain, autoimmune diseases, and metabolic health challenges. Visit Try Shed to start your wellness journey today. That's tryshed.com.
The flow.
All right, everyone, let's get into the flow. Please welcome my guest this week. I'm here with Dr. Peter Chang. He's the Chief Transformation Officer at Tampa General Hospital. So I want to welcome Dr. Chang to the podcast. Hey, welcome.
Hey, Jared. Thanks for having me today.
Why don't we start, as usual, with maybe like a 2-minute version of who you are and what you do, because that'll definitely inform some of the directions we go as we go.
Sure, Jared. So my current role is the Chief Transformation Officer at Tampa General Hospital. Just a quick background on hospital. We're kind of in West Central Florida, 1,000-bed flagship academic medical center with 3 community hospitals to the north of us that are part of our system now. I've just opened up a behavioral health hospital and also have our inpatient rehab facility. So excited to share some of the growth that we've had. But as far as my story goes, I'm a hospitalist by training. I finished my residency in 2011 and then became an academic hospitalist with the University of South Florida. That's our close academic affiliate. And quickly transitioned into a hospital admin role and have had multiple since. Chief Medical Informatics Officer, did a lot of work with inside of our EMR systems. And then that kind of pulled me into operations, built this amazing command center, initially called CareCom, now the Care Coordination Center, which I think we'll talk a little bit about later today. And in my current role, I'm really responsible for looking 5-10 years around the corner for healthcare as an industry, and more importantly, what it means for Tampa General and all of our partners.
Yeah, I'm curious, especially kind of that bridge from the CMIO role to where you are now. How does that help kind of inform you as you have, these responsibilities now to look that far into the future?
Yeah, I think it really provided the foundation I needed to understand from the back end perspective of IT, finance, operations, all of the things as a clinician you never really know from interacting with an EMR and taking care of a patient, and how integral that is to the entire operation of our health system. And now taking it a step further, we're sort of seeing a big gap that's needed across the care coordination continuum, and really figuring out how do we design the operating system now, which is a little bit different from an EMR, to really get to some of the points that we know we need to get to, such as access and patient engagement.
We'll probably get into this here in a moment, but what are some of those other foundational elements outside of the EMR that are kind of keys to that strategy? Yeah,
so this sort of operating layer, operating system that we're currently building is actually with one of our close technology partners, Palantir. So it's been an interesting journey with Palantir as a newer company in the healthcare space, but we've really taken a hold of our entire system, and it is the underpinnings of all of the automation workflows that we're starting to put in for both our patients and our team.
Nice. Well, let's dig into this role then. So as Chief Transformation Officer, what are maybe the top 3 problems that you're looking to address, right here and right now in 2025?
Yeah. So, I mean, these are big, bold ones. But it's really around access, care coordination, and quality. I always say if a patient doesn't have access, it doesn't matter what else you do, because the patient's not getting to your health system or getting access to your care. Once they're in the system, you have to be able to coordinate that care in a manner that fosters engagement, fosters follow-up, fosters improvement methodologies on continuously getting better. And that leads into the quality equation, right? So not that it's the last one, it's probably the most important one. Is anywhere you go, you want to receive high quality healthcare. And that could be taken from multiple perspectives, from a patient experience perspective, of course, from a clinical outcomes perspective. And I think as patients, we expect all of those things to be amazing. And many times some of the patient experience pieces maybe aren't as good as we'd like them to be, or comparables to some of the other industries we're exposed to in other parts of our lives. And that's really what we're pushing for is, how do we get to the point where we're really fostering that patient engagement piece?
Yeah, well, I love how you connected that, because you're right. Those are not independent strategies or priorities. They're all absolutely connected. And the piece that maybe manifests the most outwardly outside of the organization, of course, is you talk about patient experience. That's the piece where all of this is, it's kind of front stage instead of backstage. And this has always been an intriguing part of health tech and health IT to me, is understanding what all happens backstage, behind the curtain, behind what enables a patient experience that maybe is closer to somebody's expectation and helps them in their state of mind as they are being treated, as they are being cared for, as opposed to being something that's an obstacle or prevents them from feeling like they've received the care that they're looking for. So there's a lot to that. Maybe we can have a little bit more about this program. So TGH at Home, there are some other programs and services that just show that the Tampa General is focused on some more consumer-centered programs and services and making healthcare, to your point about access, making healthcare more accessible in some of those ways that do have an improved experience. Can you give us an overview of, let's start with TGH at Home, and then I'd love to hear about other services like that, but tell us how that program's going.
It's going really well. It's rapidly growing. It is a part of the Center for Medicare and Medicaid Services Acute Hospital Care at Home program, or commonly known as Hospital at Home. And what we do is we bring the hospital to a patient's home. So instead of a patient having to go somewhere to try to access care, we come out to you. We bring nurses out to the home multiple times a day, at least 2, so 2 to 3, sometimes even 4 times a day, to administer medications such as antibiotics or steroids or even blood products now. So we're doing transfusions at home. And they also get a provider visit every day from a physician or an advanced practice provider within their home or remote. And patient has 24/7 access to healthcare providers, whether it be the on-call physician or an on-call nurse, to answer any questions they may have, or if they're running into difficulty at 2:00 in the morning, we're headed out to say hi to the patient and make sure everything's okay. In addition to that, we do remote patient monitoring. And so we have eyes and ears inside of a patient's home, not physical cameras, but just ears to listen to what's going on from a telemetry perspective, so we can see their heart waveform, their blood pressure, their temperature, their pulse rate, everything that we would need clinically here in the hospital, and make sure that patient's care is progressing in the right way.
Fantastic. This is a direction or an area of emphasis that I think it benefits every part of healthcare for us to continue to shine a spotlight on what's happening and what's possible with hospital at home programs. And there are several reasons for that in my mind. What do you think is the benefit to the rest of Tampa General? What's the strategic benefit to having a program like that? I mean, I think some things are probably obvious, in terms of some patients would still prefer to be treated there. And there's just a lot that has to happen to get this off the ground.
It's an interesting equation, right? Because it's, you're always trying to balance cost, quality, access, value, all of these things across how your patients move through your system. And when you look at a state like Florida, where, we're getting about 1,000 new residents a day here to the state, moving from either other countries or other states to Florida. And with that, they're not bringing their healthcare providers, they're not bringing their hospitals with them. And so as we've seen this mass influx of people to the Florida, Tampa Bay area specifically, we have a challenge on our hands, right? We're somewhat limited by the number of beds we have within a hospital, always pushing higher acuity, more complex care here at the hospital. We, last year in 2024, became the largest transplant center in the United States by volume, with 889 solid organ transplants. So to create room for those patients, right, we have to be able to get patients that still need hospital-based care home. And that's what this program allows us to provide. So not only is it a benefit to our patients, we've seen markedly increased patient experience scores. We've seen readmission rates probably about a third of what they are in our inpatient space for the same acuity, same diagnosis patient. Our team members, which was kind of an unexpected result, our team member engagement scores are off the chart. And since we've started, I think we have 45 team members in the hospital at home program right now. Not one of them has turned over. Every single person that's joined has stayed with us. And we've been operating for almost 3 years in June. And when you look at something like that, the team member experience and satisfaction is so much higher just because of the type of care that we can deliver. Now, our biggest challenge ahead of us is really scaling, right? So I talked about access, care coordination, and quality earlier. The biggest challenge we have ahead to figure out how we actually do this is via scalability. So our primary goal right now is getting to a hospital at home census that is as safe and high as it can be to make additional space within our inpatient care areas for higher acuity care.
Let me talk about one other aspect of what I'd consider, a consumer-centered service that you're providing. I understand there's a new care coordination command center that Tampa General has going. It's using AI in some pretty cool ways. Can you tell us about that?
Yeah, so this goes back to what I talked about earlier around creating that operating fabric or operating system akin to what Apple has done in the Mac iOS and Mac OS environments, right? If you look at what they've done, they've created a really scalable software platform that allows developers to create applications that sync up directly to their operating system and communicate with other applications within that ecosystem. They're now a device manufacturer, of course, as everyone knows, phones, Apple TVs, computers, smart speakers, enabled speakers, ambient listening, all of these different technologies that Apple has come up with. There is a hardware component, but it's all built on a software ecosystem. That's what we're trying to recreate with our command center. So we initially embarked on our journey in 2018. So we've been up and running for a good 6 years now. And through that time, we've seen the advent of generative AI, large language models, complex analytics that were not available when we originally opened our command center. So we're really seeing kind of the rebirth of what we're trying to do from a clinical and operation perspective inside the walls of our hospital, but most importantly, across our entire ecosystem. So looking at the home environment, looking at the ambulatory environment, looking at the post-acute environment, and really creating that operating fabric that connects the patient through all of those different transitions. And one would think like an EMR would be good to do this, but it doesn't house so many other components that are needed to be able to coordinate care, especially as you talk about health information exchange and all the other challenges we face to make sure we have all the information in front of us when we're deciding how to treat a patient, and most importantly, engaging them to determine what their path is and what their desired path is within their healthcare journey.
I will echo that sentiment, right? Because I think when we look at in the individual components that are involved here, especially when you're thinking of it as an operating system, you have to consider what each component was meant to do and what it does well and how it does integrate. Because you're right, you take like, where does the EMR fit within all of that? Here are the things it was meant to do and it does those well. Here are the things that it wasn't meant to do. And that might be a challenge if we try to implement those in a way that they weren't intended. Just the sheer number of solutions out there, kind of lends itself to a different conversation right there. So all of this has to happen. Like the infrastructure, the operating system has to be operational. I guess the best word for it, to be able to actually make the progress that we want to make here. I definitely see some ties here between that and the hospital at home program. Where do these programs and services in general fit into the strategic planning? We talked about the hospital at home program, but I guess the operating system itself that you've referred to, how does that fit into Tampa General's strategic planning? And does that help like enable or unlock other long-term strategies that are kind of key to growing where things are going for the organization? And, I'm just curious like more about, how, because that lends itself to how do you get support and consensus and, investment dollars approved to spend on these things? Just tell me about that kind of that relationship with these programs in general with those strategic priorities.
It is sort of the cornerstone of our strategic priority. When we generically say care coordination, that's exactly it. And I know I've said that multiple times today, but, is one of those interesting things. I end up scratching a diagram on the back of a paper, getting super excited at what I drew and running down to our CEO's office saying, hey, I think I've come up with something. And that diagram has been, of course, put on a PowerPoint slide and integrated into our strategy as far as how we're looking at the system of care that we're developing for our patients. So, the biggest thing that I think we have to look at when we're driving the strategy is, always keeping the patient first, right? We've said that for so long in healthcare, but we really haven't done a great job at it. I think if any one of us takes a really close look at our best healthcare experience, it wasn't in relation to a technology. It wasn't in relation to, a specific medical drug, right? It was in relation to a person that we interacted with in our healthcare journey that knew about us, that cared about us, that we will always remember. It's that nurse, it's that physician, it's that front desk team member that was super kind during a very frustrating time of you trying to get an authorization to get into to see a physician or get a procedure. And so it's our we're using this operating fabric to drive the care coordination strategy to create scalability, because, while we want to maintain these personal connections inside of our health system because we know how vital they are to care, unfortunately, the healthcare system in the United States is not set up to have that super personalized, customized experience for every single patient. It's just not possible, unfortunately. And so we have to figure out how we're going to leverage technology to be able to speed up, advance, progress what we're trying to do. And when there needs to be a personal touch, like, we want to maintain that. We don't want it to be all of a technology experience and none of a personal experience. It's finding that right balance and mix of meeting the patient where they're at. And that's really, getting back to the strategy question, that it really is what we're trying to do in everything that we do as a healthcare organization, whether it's growth within a particular service line, whether we're looking at what physician partnerships we want to have, that ethos is taken into account.
Yeah, that has to be the foundation here. I appreciate you getting at that point here, because that really does show the direction. And it's fascinating, the discussion about what can be personalized right now, what could be personalized in the future, what we consider to be personalization has a lot of different definitions. What level, like what communications are being personalized, which piece of the experience is being personalized. And we have to consider that because that continues to evolve. What other new technologies that we haven't talked about yet are your team leveraging right now to improve the patient, like anything patient or consumer facing that kind of helps address their experience?
Yeah, so we're starting off inside of our access center, what we call our experience center. So again, being able to, you had mentioned something very, very important. For instance, say you're calling in to reschedule an appointment. So if you had an appointment a week from now, we're installing systems today that if you call in, it knows who you are by matching your phone number, just like a credit card company does or Amazon does when you're calling them. It matches to the EMR and basically pulls the schedule and says, "Hi, Jared, are you calling in regards to your appointment next Tuesday?" And you would, to the IVR, say, "Yes, I am." And do you need to reschedule or cancel this appointment? And if you need to reschedule, you go ahead and reschedule. Do you know what days you're available? You give date ranges, days of the week, next month, a specific day of the year, and it will pull the schedule and give you a list of options and text them to you. You text back which one you want, and it reschedules that appointment, right? These are the type of experiences that we want for our patients. We know many people don't want to talk to a person about this, right? We know many patients just want to be able to easily self-service them, whether that's in a phone call or can we drive them to a more digital experience via web or smartphone. I do not think it's an app. An app on a phone is not going to save the day. It's really going to be how do we engage with them in a stream that they can use, that they can understand. That's one kind of technology that we're working on. CRMs are huge, or what I call PRMs, patient relationship management platforms, which are, again, go back to all of that operating fabric that when you contact us, we know who you are. And when we contact you, we know who you are, right? That's the most important piece. The most disingenuous experience you can have with a healthcare organization is speaking to somebody about your health and them either getting it wrong or not knowing what's going on with you, right? Immediately there's a loss of trust. Even if it's the name I like to be called or, the name of my children or what I do or what I like and what my preferences are. And the only way to do that is to really scale with technology to automate some of these experiences as it pertains to how our patients experience healthcare within our system.
Just to be clear about that and to help us understand, we can be going so fast and so furious towards any of these goals that we have to make sure we keep coming back to, like, how does this appear to the person who's being engaged? How does this feel? You're right. Like, if we don't know who they are, it's not going to feel all the things that we want them to feel. It's not going to feel as trusted, as personal, all the things that you hope somebody feels in a care experience. It's hard to do that without all the foundation that you've been describing here. I love that thought. We're just connecting that with all of these efforts. Now, what if we expand that out? Because one of our themes this season on this show has been how traditional care can work with other areas that historically have been maybe thought of as like an adjacent area to traditional care or acute care or primary care. So we're talking about, things that we hear hear a lot about kind of in the direct-to-consumer world, connected fitness and nutrition, weight loss, especially mental health, sleep management. Like there are all these pieces of maybe on the more wellness or preventive side that we're seeing partnerships. They're starting to, I shouldn't say starting to, I mean, it's been many years since some of these partnerships have been out there, but there are a lot more of them. There are a lot more opportunities, you could say, for traditional care settings and hospitals, health systems to have a partnership like that ultimately can be a part of a patient experience. What's your take on that? Like, do you see opportunities for providers, hospitals, or even workplaces to partner with offerings like this? Like, I'm just curious if that's on the radar at all.
It really is. And it actually is starting off with our own team members. We've created different market segments, and we know these segments, generally speaking, are going to need to be engaged in different ways and methods. So, we have what we call the invincibles. These are the folks that don't really regularly access healthcare, but when they do, they really need it and they want it to be convenient. But we need to your point, start to engage with them from a wellness perspective before the development of chronic disease, right? And how do we identify those patients and how do we engage with them when they are in the invincible phase? All right. Then you have your young families, which are looking at the growing young families. Their primary concerns are their kids and how they're developing. So pediatrics is a big focus. Women's care is a big focus, right? Men's care is a big focus. And then figuring out how do we coordinate that type of care. And then moving on to our kind of aging in place folks that maybe have one or two chronic diseases, but are living their best life. They're getting towards retirement or retired already, and they're out there doing their thing, living their life, and need good access to healthcare again in the prevention of further advancement of chronic disease. And then you have the folks that chronic disease has already hit their shores and they're just trying to manage multiple things, extremely complex care that's going on, health literacy, those sorts of things. It's figuring out all those different avenues and how we're actually creating that patient experience. And we're starting to do that with our own team members. And figuring out, what are our communication strategies from our own health plan perspective to be able to engage with folks from a wellness point of view. And, it's hard to say. Our CEO says this all the time, as much as we want to say that we're in the wellness and health business, we're, as a acute academic medical center, we're in the sickness business, right? I just told you we were the largest transplant organization last year in 2024. That means our patients have already had chronic diseases to the point where they needed to get a new organ. And so we need to figure out how do we create the environment where we have the entire spectrum and we actually have focused strategies for each one of those different patient segment populations. I know it's a generalization, but we have to be able to figure out how our strategies align with those different populations and what are we actually doing about it.
I'm not sure I've ever heard a better perspective on being able to connect all these sides of it, the sickness side, the wellness side, and why? Because again, we have so much going on a day-to-day basis. One last question for you, because we've been able to cover so much ground here. I'm just curious, for you personally, what gives you hope for the future of healthcare in this country? And I'll tell you why this is one of my favorite questions that we ask any of our guests, is because of how easy it is to focus on the things that aren't going right. There are a lot of challenges out there, but there's so much reason for hope too. And I'm just curious what that looks like for you.
It's interesting. I think our biggest hope from my perspective is our children, right? Our biggest hope for what healthcare will be tomorrow is what we're doing with our kids today to steer them in the right direction and be the policymakers, the teachers, the healthcare professionals of the future to drive better health. Health is not delivered by a health system. Health is the way we are. It's the way we live from the time we were born to the time that we're no longer here. And every profession plays a role in that. So I really do feel, that an interesting question is, what are the last two industries to innovate? Retail has innovated, the automotive industry has innovated and automated, but healthcare and education haven't. A teacher still gets up in front of a classroom in many classrooms around the United States and teaches a certain way to 20 to 30 kids. And each one of those kids may learn in a different way. So how are we customizing an educational pathway for a particular student in the way they learn? And you can translate that directly over to medicine on how are you engaging a patient in the way that they're going to learn to take great care of themselves and continue to live their best life. And so as you look across those two industries, that's why your question really, really resounds with me to say, our children are the future of healthcare.
What a perfect way for us to wrap, because that is a wrap for this episode. Dr. Chang, thanks for joining us today, and thanks for everything you're doing to make healthcare more consumer-centered.
Thanks, Jared.